This episode of the Pain Education Corner is sponsored by the Camella Foundation. The Camella Foundation is committed to relieving pain naturally using osteopathic healing principles. Here at the Camella Foundation, we envision a world where people achieve their maximum potential by being empowered with knowledge and skills to heal themselves and others. This information is to be used for educational purposes only and not to be construed as medical advice. If you have any questions or concerns, please consult a licensed healthcare professional. Hi, it's Bill, the Knee Pain Guru, and welcome to the Camella Foundation, where we look for natural and holistic ways of relieving chronic pain. Today's guest is actually a very good friend of mine, Lloyd Robrecht, and we were on a conversation one time talking about different ways pain manifests in the body. And I thought it would be a great opportunity to bring Lloyd and his expertise onto the podcast to share with all of you in terms of why physical pain isn't all in your head. So welcome, Lloyd. I'd like you to introduce yourself, please.
Hey, Bill. Glad to be here. Thank you for having me. Looking forward to our conversation. I don't know.
Well, just share your experience. Like you work with clients as far as therapy type of sessions. So what is your experience? What brought you to that place of working in the industry?
Well, I became very interested in psychology early on, I guess in college. And I half jokingly tell people that I got interested into psychology because I wanted to figure out the female mind. Still haven't figured that one out yet. I don't think anybody else has. So I'm not alone in that. But no, I became very interested in psychology and why we do the things that we do. How do we think, act, and behave to be successful? And what are the roadblocks that we put up in our own ways to prevent us from that? And it's been an interesting journey. Have learned so much and realized that I have only scratched the surface in human motivation and potential and the aspects of life that can prevent or present challenges to us. But anyway, that's kind of a summary.
Well, how long ago was college?
Oh my gosh. I started working in the mental health field in 1993 and have been pursuing that in many different ways ever since. I've worked in outpatient psychiatric settings, inpatient hospitals. I'm now a private therapist here in Roanoke, Virginia, and I am working with a wide variety of clients with a number of issues, but my specialty is dealing with anxiety and trauma and all the issues that surround that. You know, what's really interesting to me is, and this is kind of sad in a way, the people that I see, regardless of their presentation and what they're coming in for initially, it could be a marital issue, it could be a job satisfaction issue. I'm finding evidence of trauma in almost all of these cases. You know, what they're presenting for or what they see as the problem is actually a result of behaviors that they've adapted or adopted and have become patterns for them related to injuries that they've suffered in the past, experiences that they've had, and their mode and their method of protecting themselves from those thoughts and feelings.
Uh-huh. So what is your official title in your private practice?
I'm a licensed clinical social worker, LCSW, and I'm a clinical therapist.
Got it. So you're seeing a lot of challenges and issues that the clients that you work with are a result of traumas and adaptations to those traumas.
Yeah.
That is showing up in their life in their, how they would function day to day.
Yeah. I tell people that, if we're all operating at our wonderful optimum level and our nervous systems are all clean and calm, and let's just say this line is 0,
Right.
yeah, we get knocked up is in one sense by traumatic experiences, and let's just say that 0 jumps all the way up to a 10. We never really come back down to that 0 baseline. We come back down to a 2.5 or something like that. And because of that excitation of the nervous system and kind of being pushed more towards the sympathetic side of the nervous system, we develop, hypervigilance. We're kind of looking for the next bad thing to happen. We're always feeling a little bit keyed up and wired, and go through life, have more experiences, and we're coasting at that 2.5, and something else happens, and it can be an acute trauma type thing that jacks us back up to a 9, but then we never come back down to that 2.5. We come back down to a 4. Or we could experience, less acute but more chronic situation with the kid who's bullied through all 4 years of high school. It's a day in, day out. Some days are worse, some days are better, but it's this chronic stress and tension level that a person experiences, and they get elevated to a 6, and maybe after high school they just come back down to a 4. So we're reactive rather than responsive, and that's a whole nother area right there, reactivity versus responsiveness. But this tension pattern, this anxiety, this way of defending ourselves creates problems in our relationships and how we see the world. And some people cope with it in various ways, sometimes healthier than others. But alcohol addiction or other drugs, are becoming more and more prevalent. When you dig down deeper into the issues with those people, you find that there's usually trauma there. People who just cannot make a relationship work. Why is that? Often it relates to issues that they've had in the past, and their identity, their sense of self. And this is another thing that I say to a lot of clients, is that it all seems to boil down to ego defense. We're all, and when I say ego, I don't mean arrogance or, inflated pridefulness or anything like that, but rather just this identity, who and what we think we are. That's our ego, that's our sense of self. And when anything in the world kind of comes into conflict with that, it takes a very healthy ego to be able to sit back and go, okay, how does this work? Maybe I'm responsible for this. How do I fit into that? That's not usually the response. We usually have a reaction, which is very immediate, to defend ourselves. So, and when we become defensive, when we become counter accusatory, that just elevates things.
Sure. And you shared a lot. Trauma in and of itself is a lot. And what we're trying to do is unpack some of that to connect it with the experience of physical pain in the body, which can show up. Trauma can show up in a lot of different ways. In both my experience, we've had conversations offline about different ways that it shows up. So can you connect the dots in working with clients, how their experience of this trauma, this experience of this elevated sympathetic nervous system state that tends to spike higher and then drop down to even a higher level baseline than it was before, how does it connect with physical pain?
Sure. So it depends on a person's expectations. So this is where people have to really become conscious. If they want to change, if they want to improve, if they want to get better, they have to become really aware of their attitudes, their patterns. And that's such a big concept, their patterns or habits of thought, and how that creates their expectations. So if a person is experiencing physical pain, from an injury, let's just say a knee injury, um, what is their expectation of recovery? What is their expectation or their interpretation of the significance of this? Does a person look at this as, oh, another horrible thing in my life? Great. This is such crap. Life is pissing on me. Or is it, whew, that sucked, but I know other people that have experienced it, they've gotten through it. I'll get through it too, and they go about looking for things in their life to be happy about, or do they get sucked into this shell of rumination and commiserating about, um, how badly their life has been affected by this knee injury.
Mm-hmm.
They're not focused on recovery. They're focused on their suffering.
Right. Now, I can speak for personal experience about knee injuries. After my fourth one, the knee dislocations that I had.
Did you ever ask yourself what you were doing wrong?
After the fourth one, I started.
Good.
There was a little bit of a disconnect. So I did have that experience in the first three that life was pissing on me. Like I had that experience of like, poor me, why is this always happening? Oh, I'll heal, like kind of ignoring it. I had a very healthy dysfunctional ego at that point in time.
Very healthy dysfunctional ego.
How would you?
Healthy
it was not serving me. How about that?
I'm messing with you. Yeah.
Okay. So there was this place that once I got on the other side of the fourth dislocation, it's like, I'm going to start taking steps to resolve this. Then I went to the doctor, then I got the surgery, then I went to physical therapy. So there was actually steps that I could take towards healing what was going on with that knee. I see a lot of people in that experience get stuck in different stages of that. They have the injury. They don't want to go to the doctor. So they never go to the doctor. They go to the doctor and the doctor tells them what they don't want to hear. And then they stop there. They get the surgery and the surgery isn't like what turned out how they wanted on the other side of the surgery. And then they stop there.
Right.
And then there's an expectation in there that is, this is as good as it's going to get. I'm going to have arthritis in another 5 to 10 years. My joint's going to degenerate. I'm just going to have a knee replacement, so it's like in that spectrum from the injury to I'm just facing down a knee replacement. I don't have any other options.
Right.
There's a lot in there.
There's a ton, and you hit on so many things that I talk about with clients, whether we're talking about actual physical pain or emotional pain or, the suffering, but there's the part of the expectation, but, like after your third one,
Mm-hmm.
right, and then you had the fourth one, you changed, your outlook changed, you decided to do something different. And you started thinking about your future, not based on your past experience, but on what you wanted to have happen. You wanted to have recovery. You wanted to feel better. You weren't thinking about, well, crap, I've been through this 3 times. This is just going to happen again. This is the way it's going to be. I don't know why I keep hitting myself in the knee with the hammer, that kind of thing. You changed your mindset, and that is such a difficult thing for so many people to do, because I talk with people about, what do you want your future to look like? What do you want? What outcomes? But they're thinking about, often they're not even thinking about, they're just running on autopilot. They're running out of habit, and they project a future based on what they've already experienced in the past. And more often than not, that's extremely negative. You find people that have doubts about their own abilities, doubts about what's going to happen. And you have people who doubt what they can do with their pain. They don't take a positive ownership, empowered position. They take one of, well, it's hurt in the past, it hurts now, it's gonna hurt. I see other people who have done this and now they're crippled. But those people didn't want to break out of their comfort zones.
Is there, because I see trauma playing a huge role in that. Trauma, I see it's like a skip in the record, so to speak. It brings them back to that place of, right. Well, it's always going to be the same. My knee always hurts. It's never going to change. So there's an element, and this is really where I want to connect the dots in the title of our podcast today, is how the pain isn't all in your head, that there is a physical component that's going on. The knee injury, yes.
Right.
There's a huge mental component that's going on that is bringing them back to that physical experience, not allowing it to change.
Right. So when you make that comment and it brings them back, to that place of doubt or negative thinking, that's what I call the uncomfortable comfort zone. And how trauma relates to that. Well, you have to also understand that we're distinguishing trauma now much differently than we did even 20 years ago. We think of trauma as these big, huge events, like, a person in combat seeing their comrades die and almost dying themselves, or, the brutality of an abusive partner or parent or things like that. And those are what we would call the big T's, the big T traumas. We're also identifying things as not as little t traumas, maybe what would have been thought, not what would have been thought of as trauma, but are still very traumatic, if that makes any sense. The chronic cumulative things rather than the huge spikes. So those impact on our nervous systems in a very unique way. And I'm going to get a little long-winded here.
Yeah. I mean, there's a lot. It's very nuanced. It's not a cut and dry thing. So I'll bring you back.
Thank you. If you take a person who has had a great and wonderful day, I mean, the sun was shining, the coffee was just right, they went to work, they got compliments from their boss, everybody was cheerful, and then at the end of the day, they got that one nasty email or that one nasty text message or that one nasty comment from a person. More often than not, after they go home, after dinner, all this kind of stuff, and they're laying in bed trying to go to sleep, what are they thinking about? They're not thinking about how, grateful and they are for their wonderful day. They're thinking about that snarky text message or the comment. Well, why do we do that? Well, traumatic things impact our nervous systems in a very unique way. And we tend to remember and recall those things much more often than we do the positive things. And that is a good thing in a way, because it's part of our survival mechanism. It kept us alive, generations and generations back when we were dealing with, things in our environment that could potentially kill us. It's important to be aware of and alert and to remember the things that are dangerous so that we can avoid them in the future and to be on the lookout. But we still have, so society has changed incredibly in the last 5,000 years. We don't have those levels of lethality in our own environment anymore. But in such a short period of time, our nervous systems have not adapted to that. So we're still getting alarm bells being set off, where our minds and our memories are being recalled, as you said, or brought back to that place of concern and worry and doubt. It's the fight or flight. And when a person retracts and goes back to that place of limited thinking, that is fear, which is the product of traumatic experience.
How does this tie in? And I don't want to get too far in that direction of the trauma because it actually kind of sucks you in. I work with clients that
Yeah.
have a lot of that, and it's like, oh, it's going a little nutty. But how could we bring it back to the person sitting in front of the doctor with their knee issue? Nothing's shown up on an X-ray, a CT scan, an MRI, and the doctor is telling them it's all in your head.
Oh.
They have a physical, they're experiencing physical pain, but nothing physically is showing up in the knee. The doctor's telling them, I could give you a cortisone shot or give you a prescription drugs or something like that. Where do they go from there? They know they feel physical pain. How do they take this concept of trauma, what you're sharing, bringing the body back to that place of pain? What can they begin doing to kind of get a hold of that, to recognize that, well, part of it may be in your head, but part of it is in the physical body as well?
Yeah. Well, that's a tough one, because I would ask, what is the nature of the healthcare provider that they're seeing? Then, what is the perspective of the doctor?
Mm-hmm.
Is this an orthopedist? Is this a general practitioner? Is this a neurologist? Is this, a physical therapist?
Mm-hmm.
What kind of, when you say imaging, what kind of imaging are they talking about? There's nothing physically wrong in the knee. Well, if there's physical pain there, I would say that there probably is. I mean, there's definitely the possibility of experiencing physical pain strictly because of a mental association. But, if you've got a physical issue, is it strictly inflammation, which is causing pressure on nerves?
Mm-hmm.
Is it, a small tear in, let's say, a meniscus or something like that, might show up on some things, but wouldn't show up on others? But it's, they're painful. I've had them.
Sure.
Torn meniscus from skiing. So how does that relate to the perception of physical pain? And studies have shown, and I know from experience with working with people, that if you give them a Likert type survey, rate your pain on a scale of 1 to 5, 1 being no pain at all and 5 being, like burning hell.
Mm-hmm.
A person will rate higher when they're feeling depressed, when they're feeling anxious, when they are remembering past events which are particularly negative. When a person is thinking positive and feeling hopeful about things, they rate this almost the same pain, but in a much lesser degree.
Mm-hmm. And it brings up an interesting piece, because many times clients, I'll talk to them. Today's Wednesday. They'll be out of pain. I'll give them work to do. They'll be out of pain. And then something happens Thursday, Friday, Saturday, something like that, that puts them back into pain. They went on a hike. They worked on a job or something like that where they pushed their knee too far. And then their knee goes back into pain. And I see that trauma popping up. They're like, oh, nothing's different. Everything's the same. The world is ending. It's almost like as if that experience of the relief that they got in this, Wednesday, Thursday,
it was a lie.
It didn't even happen. Right. It was a lie. And there isn't that awareness on that person's part to bring back to the point where they were out of pain and then pain started again. Like right in that space, right in that window, there's so much to be learned. Thanks for tuning in to today's episode of the Pain Education Corner. If you have a special talent or skill to relieve pain and you'd like to become a guest on our show, visit us at thecamellafoundation.org/interview. Help us spread the word on eliminating pain and suffering in the world. That's thecamellafoundation.org/interview.
Yeah, I tell people, and you just got me thinking on a couple of different levels, but I tell people that, suffer with panic, and they're like, it was horrible the day that I came to see you. Then it was better for 2 days, but then it came back. And I had a panic attack on Friday.
Right.
And I'm like, so you're telling me, and yeah, they're focused on the panic attack. And they're like, it's not getting any better. I'm like, well, you visited me once and you're telling me you had 2 full days without panic. How many days were you panic free before you came to see me? And they're like, oh, it was weeks, with of panic consistent. But not only the perception of pain, but does the mind, the brain create circumstances that actually cause pain? And I think that's definitely absolutely true. When a person is depressed and feeling negative, inflammation in the body increases. This is a trauma response. This is a protective thing. The body swells, like in a very minor, almost imperceptible way, but it's still inflammation. It's covering things, but this creates pain. We know that, when a person is anxious, depressed, under a lot of stress, their white blood cells count goes down, their immunity becomes weakened. What a person is thinking, what a person is feeling absolutely has absolutely physical effects on the body. It's not just all in your head. You're not imagining this.
Sure.
The mind is influencing the body. And my area, and what I'm very interested, whether it be emotional and the mind-body connection, I don't distinguish between, oh, well, this is a physical issue and this is just a mental issue. The mind, if the mind can affect the body in the negative ways, how can we tap into how positive thinking, positive thoughts, visualization practices, and things like that can create the positive environment for the body to decrease inflammation, decrease swelling, increase immune response, and create the environment for actual physical healing. It's not just that imagined perception.
Right. What do you believe is that piece in that spot where there's recognition, the mind affects the body, the body has the potential to affect the mind? Whether a person allows the physical body to affect the mind, I think is a different story.
Right.
What I've narrowed it down to courage. Like that is when I was looking at, and I've been in the biz of helping people with knee pain for 20 some years now. And there's this place where I see people give up so easily. It's almost like they don't have the courage to let go of the experience of the physical pain, to begin to discipline themselves, to look for where, like you had said, that person didn't have a panic attack for 2 days and they've had them for weeks. And now they're going to go right back to that dark place that they were in. Like
that's that uncomfortable comfort zone.
Yeah. How do you make it, I don't know if it's a palatable thing, because some people need to make it a palatable way of people to get out of pain or let go of that belief system. Some people need I tell my clients all the time, sometimes you need me as a cheerleader, sometimes you need me as a drill sergeant. And depending on where they're at or how they're showing up for the support that they need will depend on what I might say. So how do you work with clients to make it palatable for them, to break it down into baby steps, so that person that had 2 days relief from the panic attacks and now they're ready to give up on working with you?
Wow, that's a big question, man.
I know.
No, that's cool because we could turn this into a 4-hour long conversation,
Yes.
and I think we should. I got nothing else to do today. Um, so many points, and this kind of goes into that realm of one of the paradigms I practice from, which is NLP, or neuro linguistic programming,
Mm-hmm.
which looks at what are the patterns that the brain uses to interpret information, and how do we communicate, not just with other people, but communicate with ourselves,
Mm-hmm.
the mental pictures that we create in our head, the sounds that we hear, and the feelings that we have, these input systems of information, visual, auditory, and kinesthetic, and things like that. But you said courage, and that's a great word. It does take courage, and people are like, well, how do I get the courage? And one of the things I ask people when I start working with them is like, what are 3 or 4 characteristics, personality traits that you would like to develop? You don't feel you have enough of them, and what would you like to have more of? And without a doubt, 9 times out of 10, people say confidence. I want to be more confident. I want to be a confident person. This speaks volumes, and that is, directly related to that courage that you're talking about. You can't be courageous without confidence, right? And that shows also the role of fear. If the thing that they're asking for is confidence, it really indicates that the biggest problem in their lives is fear related, even though they don't recognize it.
Mm-hmm. Yeah, like how do you get to confidence without the courage to go through the fear to get there?
Right. Yeah. Awareness and like you said, baby steps, very small, incremental, easily digestible things. So there's a model for stress. Stress is a natural part of life, which is necessary. If we didn't experience stress and everything was hunky-dory and just fine, we wouldn't be motivated to do anything, create anything, change anything, build anything. So stress is a normal and natural thing, but we're getting to this weird place in our society where we want to reduce stress so much, and we don't want to be uncomfortable, and we just want to be, we don't see the value of having any kind of adversity or stress in our lives. So whenever we experience it, we want to run away from it. But if we say a challenge, or you have a stressor, and the number one determinant in how successful we are in meeting the stress and conquering it, or dealing with it in a healthy way, is attitude. So if we have a stressor and we're going up on this level of stress, if we believe, and like you said, courage, I use the word hope. Does a person have hope or belief in themselves? Do they believe that their resources, their supports enable them to meet this stressor and be successful in dealing with it? Then we call that good stress, or actually there's a term eustress, like euphoric, eustress. But on the opposite side, going down, if we have a stressor and we don't believe in our capacity to deal with it, we don't believe in our strengths, and we feel negatively about it, then it becomes distress. And here comes the fight or flight response again. On the positive side, we have this, fight motivation. We want to meet the challenge. We want to overcome it, and we're motivated to move towards it. On the negative side, if we don't believe in our resources and it's distressful, we want to flee from it and retract from it. So that's the role of the uncomfortable comfort zone. And why do I say uncomfortable comfort zone? It's these situations like you were describing. A person laments their situation. They hate it. They don't like it. They want it to be different. But they don't take the steps necessary to get out of it because the unknown, dealing with it in different ways than they have in the past, putting in the effort is scary. So it's easier to stay in this cocoon of apathy and suffering than to take the risk of creating change. And that's where you find that other symptom that we just talked about. Somebody experiences some positive progress, but then there's a little setback, and it's like, oh, well, there's the confirmation that I was looking for that none of this is going to work. This is all crap.
Right.
So let's just get the surgery. You know, let's take the pill rather than doing the work. So it's confirmation of their negative thinking whenever they feel that stress. A person has to develop the mental practice of projecting into their future. This is the NLP part, called future pacing. What is my ultimate outcome going to look like, feel like, sound like? What is it going to be like? What am I going to be like when I've achieved my goal? And to also understand the process so that when they hit those road bumps and experience that pain, they don't immediately go, oh, well, yeah, there it is. I proved it to myself. This shit doesn't work. And they just go back to this place of apathy and being where they were before, this uncomfortable comfort zone.
Is it the discipline of overriding the sympathetic nervous systems, looking for the bad stuff, and begin to develop the discipline to start looking for where that outcome that they want to create is beginning to show up? Like, I did have 2 days worth of relief when I had 3 weeks worth of panic attacks. Now I had 2 days worth of relief, focusing on those 2 days and seeing how they can re-achieve another 2 days as opposed to looking at the previous 3 weeks.
I think discipline is a good word, but I think discipline is a word that people look at kind of in the wrong way.
Okay.
They think of it as like this grit in your teeth and just by pure willpower, muscling through something to get to the other side. And I see it as a more subtle thing, that you make a conscious, mindful commitment to, and that you have to be aware throughout the process of that negative thinking. This is where mindfulness, reframing from NLP, future pacing from NLP, visualization practices come into play, because it's so easy to get out of mindfulness. Okay. If we have a negative experience, I'm cutting you off, man.
Okay, go.
If we have a negative experience and we've been thinking negatively about it for a long time, we're already practiced in that, right? We don't need to sit down and think, okay, I am going to dig up that thing, that experience.
That didn't work.
Huh?
The thing that didn't work.
Yeah. I'm going to dig up that experience, and I'm going to, I need to get that feeling of pessimism back, and I need to feel, crappy about it.
Right.
We don't have to practice that.
Sure.
We've already been doing that. So it's now an unconscious habit of thought. To change that around, to flip it around, that actually does take practice. We have to consciously think greater than our environment that we've created with our previous experience and our previous patterns of thought. we have to think outside that box that we've created for ourselves. And that takes discipline. That takes the conscious practice. So that's why I think that's a good word, discipline and disciple. A disciple has made the commitment to follow that path.
Right. Now you put together a practice, like what you walk your clients through when you work with them, the NLP. It was, it's exactly what you're talking about. This is actually a good segue to what we're going to include in the bonus section after the podcast. Could you speak a little bit to that? Would you call it a meditation? How would you?
It's a guided imagery or guided meditation. It's basic. I describe it to clients as a stress reduction method, but it's a guided imagery. Some people say, "Is this hypnosis?" And I not exactly, but what isn't hypnosis? If you keep your mind focused on something for a period of time, you're basically being hypnotized or mesmerized by it. But it's a progressive relaxation through using breathing, some imagery, the idea of counting down levels to a deeper, healthier, more calm and relaxed state of mind. Getting to that place of being in the parasympathetic nervous system, and then setting an intention. What is it that I want to have happen? What do I want to achieve? What do I want to feel like? I use it with clients in behavioral responses. The client comes in and says, I blew up at my family member, got really upset, said some things that, caused a lot of regret, and I feel like crap. I'm like, okay, well, let's get down to this level of mind, be mindful of it. Let's create a mental image of what do you want to act like, sound like, feel like, be like in a similar situation in the future. And when those stimuli, those circumstances show up again in the future, they're already primed for their optimal behavior, not their less optimal or negative behavior. They've already planned it in their heads that I'm going to have that moment of pause and respond rather than react.
Yeah, and this is what they could do for any situation, which would be including pain, be it knee pain or back pain, neck pain, shoulder pain, whatever that pain is. This guided imagery that you were that'll be in the bonus section is something that they can walk through and begin to program their mind a little bit to look for how that outcome that they want.
Yeah. If I had a client that, let's say high school football player and he got clipped and tore his ACL, and he's had surgery and, is walking on crutches and got the brace and all that stuff. And he steps off the curb and feels a twinge of pain. And he just comes in and goes, oh God, I stepped off the curb the other day and it just hurts so damn bad. And I just feel absolutely defeated. Like this is never going to happen, work for me. I don't know if I re-injured myself. I'm so pissed. Like, okay. So you had an experience and that pain triggered a response from you, which is like jumping up to 8, and you don't want to react that way. Okay, let's look at that situation. Let's count this down through this process, these levels of mind, and get to a place of, okay, now in the future, when you feel a similar twinge of pain, how do you want to respond versus how you reacted in the past? How do you want to feel about it? How do you want, do you want to be composed? Do you want to have a better sense of keeping things in perspective? And that understanding that this is part of the process. Also, that this is part of the process. And when that happens and people come back and say, yeah, I had a similar experience, but I was calmer about it. I wasn't so worried about it. And you know what? I would have thought it would have actually hurt more because it was more of a twist on the leg, but it didn't. It didn't hurt as much. That's what I would expect to see based on my experience.
Yeah, that's great. I think that's the direction that we're pointing the listeners of the call, that we can begin to course correct a little bit. And I think that guided imagery that we're going to have in the bonus section is going to be a great place for them to start. Lloyd, we're going to wrap up the show here just in a few.
It's only been 10 minutes.
I know, but I do like your idea about coming back and talking more deeply about other topics, because I think that this is a rich environment where people get stuck in terms of experiencing physical pain in the body. But is there anything else you'd like to tie up with, to share for listeners?
I would suggest that people who are experiencing physical pain, try to take a serious look at your relationship to that pain. Is that keeping you limited? Are you feeling defeated by it? Are you not doing things that you could do? I mean, honestly, of course, physical pain creates limitations, but are you also avoiding things that you could do out of fear? It's going to sound weird, but it works. If a person can develop the mental mindset that everything that happens to them, including what they perceive as negative or painful, if everything that happens to them is somehow for their benefit, it might be a challenge to find out what that benefit is. But if you have that mindset, you will ask that question: how is this for my benefit? How can I grow from this? What can I learn from this? You'll start finding those answers, because people usually find what they're looking for. So sometimes if we're looking for excuses, we find excuses. If we look for answers, we'll typically find answers.
Right. Yeah, that's great. That's a great way to end it.
There's
Lloyd,
the perception of pain, and then there's the suffering of pain.
Sure. Lloyd, thank you so much. Do you have a website you'd like to share with us where people can get in touch with you?
Sure. I am at LloydRobrecht.com. That's LLOYDROBRECHT.com. My email. Yep.
We'll have all of this in the show notes. Your email and everything else is on your website.
Sure.
Okay, great. Then I'll make sure all of that is in the show notes and send them over to your website. Lloyd, thank you so much. This was fun.
Thank you, Bill.
Appreciate it very much. This is Bill Paravano, the Knee Pain Guru, on behalf of the Camella Foundation. Have a great day, and we will see you on the next one. To learn more about the work we do at the Camella Foundation, please visit our website at the Camella, COMELLA foundation.org. Join us next week for another conversation on natural healing methods to eliminate pain.